One of the positive changes that has happened in our culture over the last 10 or so years has been that mental health problems have really become part of a conversation. But some of the issues that are involved with having that kind of conversation is unfortunately misuse of terms. So a lot of the technical and clinical terms that we use to describe people's symptoms might be misunderstood or even misused within the general population. In general, there are several myths that I think add to the stigma of mental health in our society, and that has to do with that if people fall mentally ill, there might be a weakness of will. That really is quite hurtful and actually prevents people from seeking treatment because somehow there might have been in their minds a moral failing. Mental illnesses are brain illnesses, and what that means is that there is something biologically going on within the person's brain that prevents them from functioning in a normal way. The other kind of myth that is out there is that mental illness is spreadable, that it's like an infectious disease, that people might actually catch a depression. And in a way, there might be a social influence that is involved when people fall mentally ill, but that doesn't actually mean that people actually spread their mental illnesses from one person to another, like a communicable disease. And so with depression specifically, it takes away a person's positive emotions. So they really can't experience pleasure that they once had. There might be many different reasons why a person becomes depressed. One such circumstance would be some sort of hierarchical social conflict or tension. One might be emotional attachment issues that are involved with how a person becomes depressed. Trauma might actually be an inciting factor for people who might be prone for depression. And then even fourth, there might be something that is similar to bipolar disorder or a related disorder where you see a person cyclically getting depressed over and over again without any known external provocation. Ask us. Find out what is actually true and what is actually false. I welcome that, and I think a lot of great doctors out there do welcome that kind of discussion.